12 warning signs of prostate cancer you should not ignore. Prostate cancer is a prevalent and potentially life-threatening disease that affects countless men worldwide. According to recent statistics, prostate cancer is the second most commonly diagnosed cancer among men, with over 288,000 new cases being reported each year. Unfortunately, the condition also claims the lives of about 34,700 men annually. While early detection and treatment are crucial in overcoming prostate cancer, many men may not be aware of the warning signs and symptoms to look out for. Today, we will discuss 12 warning signs of prostate cancer that should not be ignored. Early detection can greatly increase the chances of successful treatment and improve outcomes for those affected by prostate cancer. Just a quick reminder, we are not doctors. This video is for informational purposes only. Now let's dive in and learn more about these signs of prostate cancer. 1. Blood in seminal fluid. Observing blood in seminal fluid can be an alarming sign indicative of prostate cancer. The presence of blood in seminal fluid may be due to the disruption of the normal functioning of the prostate gland, which is responsible for producing seminal fluid that aids in the nourishment and survival of sperm. If cancerous cells are developing in the prostate, they could potentially cause bleeding within the gland, leading to the appearance of blood in seminal fluid. It's important to remember, however, that while this symptom can be associated with prostate cancer, it is not exclusively linked to this disease. Infections, inflammations, or other medical conditions within the reproductive or urinary system can also result in blood appearing in seminal fluid. 2. Pain in the bones. Experiencing pain in the bones is another alarming sign associated with prostate cancer. This discomfort typically arises when the cancer has advanced and metastasized or spread to the bones. Commonly affected areas are the hips, spine, and pelvic bones. Prostate cancer cells that have traveled to the bones can disrupt the normal bone rebuilding process, leading to the weakening of the bone structure. This can result in persistent pain and may increase the risk of fractures. Notably, the pain associated with bone metastasis from prostate cancer is often continuous and may intensify during the night or with physical activity. As prostate cancer primarily spreads to the bones in its advanced stages, this symptom often indicates that the disease is in a late phase. However, it's crucial to note that bone pain doesn't conclusively mean prostate cancer is the cause. Other medical conditions like arthritis or other forms of cancer can also lead to similar discomfort. 3. Difficulty urinating. Urinary retention or difficulty urinating is a potential warning sign of prostate cancer. This condition is marked by the inability to completely empty the bladder or struggle to urinate at all. This difficulty arises due to the growth of the cancerous tumor within the prostate gland. The urethra, the tube from which urine is passed, runs through the prostate. When the tumor grows, it can cause the urethra to collapse, making it nearly impossible for urine to pass through. This obstruction may necessitate the insertion of a catheter to allow urine to be removed from the bladder. 4. Erectile dysfunction. Erectile dysfunction, characterized by the consistent inability to achieve or maintain an erection sufficient for intercourse, could be a potential warning sign of prostate cancer. The prostate plays a significant role in intercourse, assisting in the production of seminal fluid and contributing to ejection. As prostate cancer advances, it may affect these muscles and nerves, leading to erectile dysfunction. It is important to understand that while erectile dysfunction could indicate prostate cancer, it is also a common condition that can result from various other factors, such as aging, stress, certain medications, or other health issues like heart disease or diabetes. 5. A frequent need to urinate. An increased frequency in urination can be an early warning sign of prostate cancer. The prostate gland, which is located just below the bladder and surrounds the urethra, may enlarge due to the presence of a malignant tumor. This enlargement can squeeze the urethra, leading to a frequent urge to urinate. Men may especially notice this symptom at night, often disrupting their sleep cycle. However, it's essential to understand that this symptom is not exclusive to prostate cancer. Benign prostatic hyperplasia, BPH. A non-cancerous enlargement of the prostate can also cause similar symptoms. 6. Loss of bladder or bowel control. If you're experiencing a sudden and unexpected loss of control over your bladder or bowel movements, it could be a potential sign of prostate cancer. The prostate gland is situated close to the bladder and the rectum, making it possible for a growing tumor to affect these organs directly. In particular, an enlarged prostate may press against the bladder, leading to urinary incontinence, where there's involuntary leakage of urine. This can occur when you cough, sneeze, or exert physical effort, stress incontinence, or it may lead to a sudden, intense urge to urinate that is hard to control, urge incontinence. On the other hand, bowel incontinence, the inability to control bowel movements, can arise if the tumor has spread beyond the prostate and begun to affect the rectum. This could result in uncontrolled passing of feces or gas. 7. Blood in the urine. Hematuria, the medical term for blood in the urine, could be a potential red flag for prostate cancer. This condition can manifest as either a pink, red, or cola color hue to the urine, or as mint amounts of blood that can only be detected under a microscope. Hematuria results from the disruption in the function of the prostate gland due to the growth of cancerous cells. These cells could lead to bleeding within the gland, which can then mix with urine as it's excreted from the body. While hematuria can be an alarming sign, it's crucial to bear in mind that it's not solely linked to prostate cancer. A wide range of other medical conditions, such as kidney stones or bladder infections, can also lead to blood in the urine. 8. General tiredness and fatigue. If you're noticing a persistent feeling of tiredness or fatigue that is not alleviated by rest, this may be a sign of prostate cancer. This isn't your everyday weariness from a hard day's work or lack of sleep. This form of fatigue often feels profound and overwhelming, and it can significantly interfere with your daily activities. Prostate cancer can lead to fatigue in several ways. In some cases, the body's immune system is working overtime to fight the cancer, which can drain energy levels. Additionally, the stress and emotional impact of dealing with cancer can also contribute to feelings of exhaustion. In advanced cases, the cancer can cause anemia, a condition in which the body lacks enough healthy red blood cells to transport oxygen to the body's tissues. This lack of oxygen can cause fatigue. It's important to note that fatigue can also be a side effect of some treatments for prostate cancer, such as radiation therapy or hormone therapy. 9. Difficulty starting or stopping a stream of urine. Struggling to initiate or halt a flow of urine can be another early indicator of prostate cancer. When a tumor forms in the prostate gland, it may grow and press against the bladder or urethra, leading to issues with urinary flow. As a result, men may find it challenging to begin urinating, maintain a steady stream, or abruptly stop once they've started. They may also experience dribbling or leakage after urination. It's important to remember, however, that this symptom can also be associated with other conditions, such as benign prostatic hyperplasia or a urinary tract infection. Remember, early diagnosis could make a significant difference in the effectiveness of treatment. 10. Unexplained weight loss. Unexpected and significant weight loss can sometimes be an indicator of advanced prostate cancer. The weight loss isn't typically linked to changes in diet or exercise, but rather alterations in how the body metabolizes food and uses energy. As the cancer progresses, it may interfere with the body's ability to break down nutrients effectively, leading to a condition known as cancer cachexia. This can result in weight loss, muscle wasting, and a decrease in appetite, even when caloric intake is maintained or increased. While it could be a symptom of other health conditions, it's crucial not to overlook the possibility of prostate cancer, particularly if it's accompanied by other prostate-related symptoms. 11. A noticeable burning while urinating or during ejaculation. Experiencing a noticeable burning sensation during urination or ejaculation can be another indicator of prostate cancer. This discomfort can arise from an enlarged prostate gland due to a tumor, which can cause inflammation and irritation of the urinary tract or seminal vesicles. In some instances, this irritation may extend to the urethra, causing a burning sensation during urination or ejaculation. Although this symptom is distressing, it's important to bear in mind that it can also be a symptom of a urinary tract infection or sexually transmitted infection. Hence, While a burning sensation should not be ignored, it should be evaluated in conjunction with other symptoms and medical tests to determine if prostate cancer is the underlying cause. 12. Pain and discomfort in the pelvic area, lower back, or upper thighs. Experiencing pain or discomfort in the pelvic area, lower back, or upper thighs can be a sign of prostate cancer. This is often caused by a tumor in the prostate pressing on nerves in these regions, leading to persistent or recurrent pain. As with other potential prostate cancer symptoms, it's essential to understand that these discomforts are not exclusive to this disease. They can also be associated with benign conditions like benign prostatic hyperplasia or even a simple urinary tract infection. The crucial factor here is to pay attention to any persistent discomfort, particularly if it is associated with any of the other symptoms discussed. It's crucial to note that having one or more of these symptoms doesn't necessarily indicate cancer. Regular screenings can also help catch any abnormalities early. Listen to your body and be proactive in safeguarding your health. Keep in mind, though, we are not doctors, and this information should not be considered as medical advice. This video is for informational purposes only. If you found this video interesting, I invite you to subscribe and check out our video on top 12 cancer myths versus facts, debunking common misconceptions.